Thank you, Acting President. Well, it's a great day today. Not only are we celebrating Day for Daniel, for Bruce and Denise Morecambe up there in Queensland doing their magnificent walk and wearing the tie today, of course, in support of them, and of course Miss Maxwell. Everyone, it's good to see some people wearing red today. And also for World Teachers' Day, so which is fantastic, paying tributes to the teachers out there, especially my wife. They're all inspirational, so you all do a great job. And we also have the Safe Patient Care Nurse to Patient and Midwife Ratios Bill 2020, momentous. So I'd like to make a brief contribution to the debate on this bill. And of course, the bill itself follows on from the government's initial bill in 2019, which Ms Maxwell and I were happy to support then and we're happy to support now. Now, this bill seeks to achieve a number of things, including amending the rounding method used when determining staffing requirements, amending certain nurse to patient and midwife to patient ratios on specified shifts in certain wards, and amending the Child Wellbeing and Safety Act 2005 to require providers of certain maternal and child health services to employ or engage nurses for those services only if the nurses have prescribed maternal and child health nurse qualifications. It incorporates 4 main sets of changes to the structure of the nursing and midwifery workforce within the Victorian public health system. Chiefly, it widens the application across the health system of recently changed rounding methods used for the determination of minimum nurse to midwife staffing requirements via nurse to patient ratios. I truly believe if there is one positive to come from this stubborn pandemic, it is that the public now have a greater appreciation and understanding of the importance of our healthcare workers, as we've all said in this chamber today. From the administration staff who welcome patients in our hospitals to the nurses, doctors and surgeons who treat their patients, all of their work is invaluable. It has not gone unnoticed and we thank you very much. Despite the importance of healthcare workers, resourcing has long been an issue. Our nurses have a challenging enough job without having to worry about inadequate staffing. This is why this bill is so important. It enshrines in legislation the minimum number of nurses per patient for hospitals. You can have the most modern and innovative hospital wards in the world, and in many cases we do, but if there are not enough qualified nurses to look after these individuals, then all of that investment in resources is made redundant. Nurses really are on the front line in terms of patient care in our hospitals. As a member for Western Victoria, it would be remiss of me not to mention that this bill reclassifies Warrnambool-based hospital from a level 3 hospital to a level 2 hospital from the 1st of July 2022. I think that this is an important change which will result in more staffing at the Warrnambool-based hospital and hopefully result in better quality of care for patients. I've been in contact with local stakeholders, including the Mayor and CEO of the Warrnambool City Council, who all support this reclassification. The government has gone to some effort to explain that between the same bill in 2019 and this bill now, there will be the creation of over 1,100 new jobs, 600 through the previous bill and 500 through this bill. More jobs for nurses and midwives in Victoria's public hospitals can only be a good thing, not only for Victorian patients, but those aspiring towards careers in these fields. Finally, I would like to place on the record some remarks about aged care. And as Australia faces an ageing population, it's going to become increasingly important that our aged care sector is adequately resourced and staffed. I noted that this bill, I'm not referring to you, Mr Button, I think you've got a while to go yet. I note that this bill does not expand ratios into aged care, as the provision of this sector, as has been stated before, is a Commonwealth responsibility. That said, there are of course a handful of state-funded and managed public aged care facilities. Ms Maxwell was right to place on the record our party's views on aged care in 2019 when debating the previous instalment of this bill. And whilst in the Senate, Darren Hinch aptly stated that politicians forget the only difference between them and old people is that they got there first. And of course this is true, but it also speaks to a bigger problem about aged care. There is seemingly a disconnect between politicians and aged care. Only last week, the Premier shared his concerns about placing his mother in some aged care homes, and this is understandable. When you've been told that your parent or grandparent is safe in their room and then find out that they've passed away without anyone checking in on them, you simply do not care if it is a federal, state or local government fault. You just want the issue fixed. COVID-19 has shone a spotlight on the awful state of aged care in Australia. Some patients being showered every 4 days, disabled people being prematurely locked up in aged care facilities due to a lack of alternative accommodation, and the list goes on. While this bill improves conditions and resourcing for nurses in hospitals, the same approach must be taken towards outlining mandatory safe-to-patient ratios in aged care homes. As I mentioned in a recent submission to the Senate Community Affairs Legislation Committee, there is also a need for aged care providers to outline how much money they are making and where exactly this revenue is being spent. Looking after the sick and vulnerable must be a priority for all people in this place and more broadly for all tiers of government. We have been entrusted to make decisions on behalf of people to improve their lives. Let's not waste it. I commend this bill to the House.